Hi, Hare Krishna, Jai Hind. This video is especially for the 4th, 5th, 6th Pharm D students after recently coming across the examinations and other things where they have presented their clerkships and other things, especially on the medication history interview. I would like to throw some light in this session. Don't be very formal with the medication history interview because everything cannot be listed in the paper or in the format and it cannot be written down. See, as a pharmacist, our intention is to gain as much information possible where which information will be helpful for us to communicate to the medical team or to the paramedical team or to the administration staff or to anyone, even to the caregiver of the patient in turn, to give an ultimately proper treatment to the patient. That is what is the aim. Our aim is not to find mistakes. Our aim is to reduce the mistakes in the process and then to enhance the adherence levels of the patient and to ensure that the patient comes out of the disease or he gets cured or he gets a proper clinical outcome which is intended out of the therapy that is to be given to the patient. Now, coming to medication history interview, when a patient comes and when you are going to take a medication history interview, please ask him where does he come from. Like, he comes from his home, he is referred by another doctor, he comes from another facility. All those things also have to be taken into account. Next is the family records, like, do their parents have, the grandparents have any such kind of an issue or whatsoever it is. All these things have to be gathered, right? And when we talk about past medication history, it is not just past medication history, it is his past illness history or health history as a whole, right? And nowadays we are aware that more of multivitamin formulations are available over the counter. Various drugs have been listed as over the counter drugs. There are many alternative medicines that are practiced in a country like India, like Siddha, Ayurveda, naturopathy, and all those things. There may be an surgery or an operation that which the patient had undergone in the very past, like before 20 years, which he has not, brought into record in the recent past for a particular disease that which he is suffering today. All this could be the reason. There may be a patch. His habit may be to drink more coffee or more tea or even more lime juice or even some buttermilk. So anything that is related to his health, his input, processing, and output will all be have to be calculated under, or will all have to be collected under the medication history interview. The idea of this interview, if we understand the objective of this interview, is to communicate either to the physician who is going to take care of the patient or to the administrative staff on what are the positives, negatives, a SWOT analysis, like strength, weaknesses, opportunities, and threats of what the patient is undergoing now, what are his feelings now, what is his stress level, what are the additional medications that he is taking. Even in case of diabetic people, they might be taking methi seeds in the morning. Probably they will not tell to you in a formal medication history interview. What we have to do is to understand, can I understand about your diet levels, about your food habits. When do you take a coffee, when do you take the medication, what medications you are taking now, what medications you have been taking prior, who advised you these medications, do you have a record of all these things, or on and off have you taken any other drug. Some people might be taking right, which is an OTC medication, but that may cause hypertension in certain patients where ACS or other already diagnosed cardiological problems are there. They might be continuously taking so which should not be the case. So like this, we will have to inquire deep into the roots of the patients, and to say that we have to know 360 degrees of what the patient thinks about his current disease conditions, his past, his family's past, his social past, smoking, alcoholism, he wakes up till night, and all those things, right? So we need to have a complete 360-degree view of what the patient thinks, feels, what is his stress level, what is his alternative medicines, if any, what are the home remedies that he is taking, if any. All these things have to be covered under the past medication history. If we are not going to cover all these things, we are not covering actually the past medication history just by listing what are the comorbidities or the diseases in the past 4 to 5 years, and then the job is not to just act as a information collector in the past 4 to 5 years. We need to collect actually what all are his physical, mental, as well as belief based systems, as well as his practices in terms of food, in terms of home remedies, in terms of alternative medicines, even a patch, even a drops in the eye, or whatsoever it is. All those things have to be considered under past medication history. And after taking past medication history, our job is to analyze and understand what are the outcomes of this interview, right? So we need not just mention it down and then pass away. Like, say, aspirin and clopidogrel has been taken for 4 to 5 years. Is that right? Is he a patient who should continue like that? Or a ticagrelor has been taken for more than 2 years time. Is ticagrelor a drug that has to be taken for more than 2 years, or it is required only for 1 year in ACS patients especially? Is he a patient for ticagrelor first, and why is he taking it like that? Some patients keep taking pantoprazole early in the morning for more than 1 to 2 years. You know that calcium reabsorption can happen with PPIs when it is continuously taken for over a period of time. Was that re-prescribed? Was the patient taking it himself by again and again taking from the pharmacy? So all these things have to be discussed in the past medication history, and we need to do a ADR, a drug interaction check, and all those things. And whatever the patient knows, why is he taking this drug? We need to understand whether he knows why is he taking this drug. Was he counseled for taking that drug? How to take that drug? When to take that drug? What amount should be taken? When the dose is missed? All these things have to be covered under past medication history. It may not be written over there. Maybe there is a remarks column or a comments column where the pharmacist has to apply his. See, you are going to be the CPU there. Like, you get an input and you will have to analyze it in all 360 degrees. Maybe some patient did not get cured of his calcium levels, or it did not increase because the tablet used to be so big and he is not willing to swallow it, and he throws away the tablet. So the problem is with the patient's thought process that this tablet I will not be able to swallow. Maybe there is a psychological barrier with the patient that he is not able to take that tablet. And so we need to understand as pharmacists that what is preventing the patient from not adhering to the schedule, or what is making the patient go to alternative therapies, what is making the patient not to have belief in the current therapies, or what is making the patient, who suggested all these things, who are the influencers of the patient. All these things should be understood in a medication history interview. It is not just about his past 4 5 years and the medications that he is taking. We should not stop only with that. So please understand, when we take past medication history, we should be able to understand a 360 degrees view of what he is taking, and we need to give an analysis of what we have understood from the patient. Is there anything wrong? Is there anything suspicious? Is there anything that we need to work upon? Is there anything that we need to communicate to the doctor? He is not able to take up insulin injections in proper times. He is not able to, he is afraid of injections. Maybe there are n number of things that can prevent a patient from not adhering to his routine, or he is not able to take care of his medication levels, and so he has come with a complication today. Now, is he coming from a secondary medical center? Is he coming from a reference of a doctor? Is he from a GP? What is his problem? And all those things, like, these things also are a part of the past medication history. We should not just go with only 4 5 years medicines, what has happened, and then say that this is what is the past medication history. Especially for the fourth, fifth, and sixth Pharm D people, please understand that involvement matters, right? So whatever we talk, we give promises as pharmacists, it's not going to work. Promises are promises, excuses are excuses. Performance is the only reality. Unless we perform and prove that we can add value to the system, we will have no place, respectable place in the system. Thank you.